It's okay, they can't hear me. Oh wait, or maybe they can.
Hi, everybody. Thank you for joining us today. We'll get started in just a moment. We're just waiting for a few more people to join. Hey everybody, thank you for joining us today. My name is George Stamboulis. I'm a clinical director and physical therapist at Spear Physical Therapy at West 44th Street. We have a great webinar today on muscle strains. It's going to be about an hour long. We have some great presenters. For those of you who don't know us, we're Spear Physical Therapy, and we're a private outpatient physical therapy practice with 20 locations in the New York City metro area. Throughout this pandemic, we have been, treating patients, definitely the ones that are post-op, and now we're open full-time. We have options of telehealth therapy and in-office therapy. In office, we're taking our CDC guidelines very seriously. We're going above and beyond that, making sure that the staff and our patients are taken very good care of, and safety guidelines are utmost importance. For our webinar today, it's really important that we go over a little bit of a disclaimer, and the disclaimer is just to make sure if you have any pain or any discomfort with anything that we're doing today, you really want to stop and email either one of the presenters or one of the hosts to make sure you get properly assessed for your specific case. We also have a Q&A section at the end of the lecture that's going to be obviously answering your questions. Just make sure when you're submitting a question, you're not submitting the question in the chat, and you're submitting the Q&A function down at the bottom of the screen. So we'll try to get to all of the questions, but if not, we'll try to reach out to you at a later time. So without further ado, we'll get into our goals for the day. So to start, we're going to be going over the muscle anatomy of different commonly strained muscles. And we'll go over some strategies to prevent these strains from happening and treating them when they do happen, as well as some exercises that you can do on your own. So feel free to follow along. And then at the end, we'll be taking your questions and trying to get to all of them. If we can't get to it, we will try our best to get to it at a later time. So let me introduce you to our awesome presenters for this webinar. So to start, we have Michelle Dearwater. She will be helping me on the back end, going over some of the questions, answering some of your questions. Michelle is a clinical director and physical therapist at our West 75th Street location. Next up, we have Sarah Lloyd, who's one of our presenters. She is a physical therapist at West 44th Street. Her main expertise is in sports rehab, sports therapy, and she's also on the side a coach for lacrosse.
Hi, everyone.
And then lastly, we have Gabby Marinaccio. She's a physical therapist at West 44th Street. She also has a great deal of knowledge in ACL and sports rehab. So thank you, Gabby.
Hey, everyone.
All right, so I'm going to be shifting it over to Gabby. She'll get us started for today.
All right, thanks, George, for the awesome intro. And thank you, everyone who is here for joining us. Just a reminder, please put your questions in the Q&A, not the chat button down below. We're going to leave a lot of time for questions since this is a pretty hot topic. And I know that you guys probably will all have questions at the end of this. So make sure it's going there so we can answer them at the end. All right, so pains and strains. To really understand strains of a muscle, we got to go all the way to the basics and look at the anatomy. So what you have on the screen here is a picture of a skeletal muscle, which is the muscles that you would think of when you're working out or when you get injured. So if you look, the big pinkish structure is the whole muscle belly itself. And then you can see how they're divided into smaller sections called fascicles. But what we care the most about is that smallest little section there, which is called a muscle fiber. So as you can see, the muscle belly itself is made up of dozens, if not hundreds, of muscle fibers. This whole muscle belly is connected to bone by what's called a tendon. So a tendon is connecting muscle to bone, which is different than a ligament, which connects bone to bone. So that's basically the most important thing to remember is we're focusing on tendons and muscles here because most strains happen at what's called the musculotendinous junction, which is where that tendon and muscle meet the bone. All right, so I have a pop quiz for everyone. What do you think a strain actually means of a muscle? So you're gonna have choices here. So everyone answer. I know you guys probably weren't expecting a quiz here, but we like to be a little interactive. I wish we had like the Jeopardy theme music here. All right. Once we get a good amount of people to answer, we'll share the results. Okay. All right. So you guys did a pretty good job. 47% said all of the above. It was a little bit of a trick question. The answer is all of the above, but the other ones aren't technically wrong. All right, so we're gonna go on to the next slide. Perfect. So what does it mean to strain a muscle? Like we said, it was actually all of the above on the poll because a strain is graded from 1 to 3 based on severity. So a grade 1 is the most mild type of strain. It's really just an overstretch of the muscle fibers. If you come into a doctor's office, there's not going to be much to find on an exam, but it is going to be painful, but that's the type that will probably just go away with rest and normal activity. Grade 2 is what we see the most in the clinic. So a grade 2 is a partial tear, but it's of those muscle fibers. So I don't want you to think of that big pink muscle that we talked about in the beginning. Think about how little those muscle fibers are. That's what's actually getting torn. So it's not the whole muscle, it's those fibers. So if you look at this picture to the right, the normal is the muscle fibers lined up nice and straight like they're supposed to be. Grade 2 is those partial tears that kind of make them go like mismatched like that. So it's not a straight through tear, it's just the fibers getting pretty disrupted. This can take 2 to 3 months before returning to sport, or if you're not necessarily an athlete, just regular recreational activity. Grade 3 is the most severe kind. That's a complete tear or rupture. This is like, think, Kevin Durant when he ruptured his Achilles and you kind of saw that snap if you watched that. This may require surgery to repair and is a much more involved rehab process. All right, so now that we know what a strain is, we have to talk about how it's going to start to heal. So before we even talk about the outside physical therapy rehab type of healing, your body is going to start immediately its healing process. It's smart like that. So the first phase is inflammation. People hear inflammation and immediately go, oh, that's a bad thing. In this case, it's not. The inflammation actually brings cells and growth factors to the injured site to start healing the fibers that it can and taking away the fibers that are too injured to repair. So if you have too much inflammation with a lot of swelling, this can slow down the process, but inflammation in general right now in that first 5 days is actually a good thing. Once that's done, you go into the repair phase. So this is when new collagen starts to form. Collagen is just a fancy word to talk about connective tissue that's going to eventually turn into like the tendon. So new collagen starts to form to replace those torn and bad fibers, and new cells come to, again, continue to grow since we had a bunch of injured cells. Then the last phase that can take all the way up to a year is remodeling, which is when that collagen goes from that mismatch that we saw on this last slide to nice, straight and even, which can resist stress better and allow you to get stronger. So now I'm going to pass it over to Sarah, who's going to talk about how we actually help with this in rehab and PT.
All right. Thanks, Gab.
Sarah.
So Gabby did an amazing job of giving us a little bit of background on kind of the muscle anatomy and what it really means to strain a muscle. So now we're going to focus a little bit more on kind of the clinical side and what happens when you strain a muscle, how it happens, and what you do about it. So we're going to have you guys answer another poll. Have you ever strained a muscle? I know a lot of people who are attending this webinar probably have, and that's why you're here. A lot of us have. Welcome to the club. But we figured we'd get an idea of kind of like what you guys are looking for with some of these exercises and what we're going to talk about. I think it's a pretty common injury, which is one of the reasons we wanted to bring it up to you guys today. So 96%, woo, all right. Most of us have strained a muscle at some point, which is really great, which totally makes sense. So the first thing we're gonna do is look at commonly strained muscles. So we're thinking the 3 most commonly strained muscles we see in the clinic are typically either your hamstring. So the hamstring can happen in 2 places. It can happen up by your glutes where that arrow is pointing, or a little bit down closer to your knee. So there's 2 options for the hamstring strain. And then we have your calf, or gastrocnemius is the official name of that muscle. The calf has kind of 2 bellies. So both of those bellies are part of that one gastrocnemius. It just has 2 heads. So that's your calf. And then your biceps is another commonly strained one. So when we go into our exercises at the end, we're going to focus on these 3 muscles. Obviously, there are many other muscles that you can strain in your body, and we can cover a few of those in the Q&A, but we figured we'd pick 3 at least to start, since they're kind of what we see the most of. So moving on, we're going to now look at kind of how strains occur in real life. So I think the biggest thing we have to focus on is just a quick review of like what a muscle is and how it works. So if you think about your biceps, right? When we like do bicep curls, we think we're working our bicep, especially like coming up, right? So if I have a weight and I'm doing a bicep curl, I'm working my bicep here because I'm shortening the muscle and using it at the same time. If I go slowly on the way back down, you'll feel that's more difficult. And that's because it's the eccentric portion of the muscle working. So the muscle's lengthening and working at the same time. And that's actually the moment when muscles are more likely to be strained. So that eccentric is harder to control. And if that eccentric contraction is too quick and too forceful and the muscle can't handle it, that's when you get that sort of strain. So it's easy to think about with the biceps. It can also happen in a hamstring when somebody's sprinting. Your hamstrings actually work eccentrically throughout the sprinting phase, especially at certain points. And so that's really common in that part of the sprinting cycle. So when people think, you know, like I overstretched my muscle, like, yes, you definitely overstretched it, but it's more likely to happen when you're using the muscle than if you're just kind of like casually doing a hamstring stretch. Like you're unlikely to strain your muscle, your hamstring muscle, if you're just doing a hamstring stretch versus if you were trying to sprint. So that's kind of how they occur typically in real life. Now we're going to talk about what happens when they do. So you've just strained a muscle, right? Like running, oh, pulled my hamstring. Oh my gosh, what do I do? So you guys, many of you have probably heard about RICE before, which is rest, ice compression, elevation. We have a little bit of a PT version of that, which just adds a couple of things to it. That first phase that Gabby was talking about with inflammation, we want to make sure that that inflammation happens. However, our bodies tend to overdo it a little bit, and they'll send a ton of growth factors, a ton of new cells, and sometimes it's too much. So that's when that ice, that compression, elevation comes to just kind of lessen the inflammation if it's getting in the way of your joint range of motion and that sort of thing. Early on, we also want to protect it. So when we say protect, we actually don't mean sit there and do nothing. We just mean, you know, don't stress it too much because it's already been stressed and it needs a little bit of time to kind of heal and let the inflammation happen. So depending on the muscle, we can talk a little bit about what that looks like. We'll show you with a couple of the beginning level exercises. Manual therapy. So if you come to PT, we'll do some manual therapy in terms of some massage and soft tissue techniques. Now there's kind of all these tools out there that you could use yourself as well, like some of these massage guns or foam rollers. Typically, initially, it's a little bit too much to use some of those tools, but you do want to stimulate that blood flow and the muscle healing. Like if we stimulate the blood flow, blood brings with it all of these good growth factors and cell growth that Gabby was talking about. So we stimulate that with a little bit of manual therapy, because like Gabby said, those muscle fibers were kind of out of alignment when some of them are torn. Some of this manual therapy will bring in the cells, and we can help kind of alleviate some of those muscle fibers and get them to kind of correctly align during and when we do exercises. And then early motion is also important. So like I said earlier, we want to protect it, but we don't want to just do nothing. Because for example, if you strain your biceps and you're in a sling and you stay in a sling for a week, your elbow is going to get stiff, that bicep's going to get stiff. Those muscles are going to try and heal themselves like this instead of in that kind of the correct angle. So we want to make sure that we're moving it a little bit, not putting too much stress or too much tension on it, but you want to stay active and stay moving a little bit. Lastly, we're talking about not stretching it. So I know a lot of people, especially with the calf strain, for example, or maybe the hamstring, are thinking, oh, I just strained my muscle, my calf, I need to stretch it. You don't really, you need to do that motion that we talked about, but if you have muscle fibers that are not in line and you just try to yank on them after they've already been torn, they are not going to be happy. So if you try and hold a stretch for 30 seconds, it's just going to irritate the muscle fibers more in that inflammation phase. So we want to stay away from prolonged stretching initially. So after we've gone through that inflammation phase, which can be anywhere from 2 days to a week or so, we're going to talk about what we do in rehab afterwards to kind of make sure that the muscle heals well. So we start with what we call isometric exercises. So we'll show you those in our exercises, but if we talk about the bicep, for example, we were using it earlier to talk about how this is concentric, this is eccentric. Well, if you just hold right in the middle and you put resistance on it, but you don't move, that's isometric. So you're using the muscle, but it's not shortening and it's not lengthening. That's how we start. And then we progress to those eccentric exercises that take the muscle through its full range and work it at the same time. Because eventually we want to get back to where you were before, where you can sprint and run and jump, and the muscle and tendon are strong and good to go. Especially if there's some tendon involvement. So like Gabby talked about, that musculotendinous junction is the most commonly strained portion of the muscle. If there's involvement there, tendons like to remodel really well eccentric exercises. So once we can get to that point in rehab, we're going to focus on those type of exercises. When you're doing these exercises or at PT exercises or kind of any exercise in general, it should be relatively pain-free. So if you get a little bit of kind of like some feeling or some tension in it here and there, like a 1 or 2 out of 10, that's okay. But if you notice a lot of swelling, if it's really hurting while you're doing an exercise, then that probably means that exercise is too much for that muscle and you're going to set back the healing. And then lastly, why PT is so important is we want to know why that muscle strain happened in the first place, right? Was the muscle itself not strong enough to handle the force? Or were you asking too much of that muscle and there should be other muscles that are doing their job really well, but maybe they weren't doing their job in this case. So maybe your hamstring or your calf tried to help out and that's why it strained. So that's what we look at in PT to make sure that kind of all of your muscles are functioning the way that they should, so that we can avoid overusing and overstraining certain muscles, just so that you don't want to, get another muscle strain in the future. We want to get you guys as injury-free as possible for the rest of your life. All right. So now that we've kind of gone over some anatomy and some rehab mechanics, we're going to bring Gabby back on screen, and she and I are going to kind of together go through some of these exercises for those 3 commonly strained muscle strains that we talked about. So glad
Sarah. Great job, Sarah. All right. So would you mind being the demonstrator first and I'll explain?
Would love to.
All right. So Sarah is going to start by showing us a couple of exercises for the hamstrings. So for the first early phase here, so this is like acutely just when it first happens, we're going to show you both how to treat if it's one of those proximal strains that Sarah talked about. So the back of your leg kind of up closer to your butt versus the distal, which is the one that's, again, back of the leg, but down closer to the knee. So Sarah, let's start with proximal. So we're going to do a proximal hamstrings isometric contraction. So again, that's when the leg is not moving, but the muscle's turning on. So you're going to lay just like Sarah is on your back with one knee bent, and then the knee that you're wanting to work is the one that's straight. She's gonna dig her heel into the table, and she should feel this squeezing in the back of her leg, right below her butt, up to right below the back of her knee. She's gonna hold that contraction for 10 seconds, then take a break, and she's gonna do it 10 times. She's not gonna do it 10 times right now, but if you're you at home, you're gonna do it 10 times. So that would be for the proximal part of the muscle. And then if you wanted to get more of the distal part of the muscle, you would go ahead and bend that knee, not quite as bent as the other leg, but still bent. And then you're gonna do the same thing. You're gonna dig that heel into the ground. You should feel it in the same place, maybe just a little bit lower, closer to the knee for this one. Again, holding for 10 seconds. If you're doing it at home, you're gonna do it 10 times. How's that feel, Sarah?
Whew, I'm getting tired already.
Well, you got late phase next, which is a little bit harder, so I hope you're ready.
It's okay, I'm ready.
All right. So we're gonna start by showing you what's called a single leg RDL or Romanian deadlift. So Sarah's gonna stand on the leg that is bothering her. She's going to go ahead and lift the other leg off the ground and dip her body forward, keeping her back nice and straight, just until she's about parallel with the ground, making like a T shape. A lot of people say that they feel this as a stretch, but that's exactly what an eccentric contraction is, right? It's lengthening like a stretch, except the muscle is active and you're going nice and slow to control it. So you should feel this again down that back of your leg from right under your butt to the back of your knee. And then the last one, if you want to get more distal again, she's going to go ahead and get right back up on that table. Knees are going to start bent. She's going to bridge up. So she's going to lift her hips, squeeze her butt there, and then she's going to slowly slide her legs straight and then go ahead and start over. So again, that's going to be an eccentric lengthening and contracting at the same time of the hamstrings, feeling it in the same spot. Again, maybe a little bit closer to the knee for this one because it's working that distal part a little bit more. How'd that feel, Sarah?
That one was tough, not gonna lie.
That one was tough. I'm glad you did that one.
Hey guys, we got a question I just wanted to ask. The difference between proximal and distal when we're to, your leg or the exercise that you're doing.
So I can take this one, Sarah. So proximal just means closer to the center of your body. So if I was looking at my arm, my shoulder is more proximal than my elbow, which is more proximal than my wrist. Same thing for the hamstring. So the part that's up closer to your glutes, closer to your core, right? So more proximal than behind your knee, which is farther away. So that would be more, that's the word for that is distal. So distal is just farther away, proximal is closer, all relative to the center of your body or your core. Thanks for that question.
Yeah.
Okay,
Awesome.
My turn.
Thank you. Thanks, Gab. Okay, so we kind of covered it for hamstring. So like Gabby said, if it's the proximal, you do the exercise with your legs straight and the RDL with your legs straight versus the distal, your knee is just a little bit more bent for those exercises.
And you'll also get a handout of these, so you don't have to memorize them.
True. Okay, so now Gab's going to demonstrate for the biceps exercises, since that's another commonly strained muscle. So here again, we're going to start with our eccentric and start with our isometric and work to our eccentric. So first, Gabby is just going to demonstrate an isometric bicep curl. So she starts with her arm at her side, just like that. She applies resistance with her opposite hand. And this is totally your tolerance in terms of how much you are pressing with that opposite hand. So if it hurts, you're pressing too hard, don't press as hard. You're in control of how like the force that you're producing through that muscle. So the arm is not moving, you're just using your own opposite hand as resistance. Hold for 10 seconds, take breaks in between, perform 10 times, just like the other isometric exercises. Then so that's kind of early stage. Later stage, we're going to switch to an eccentric exercise for the biceps. So the biceps does elbow, it moves your elbow, bends and straightens it. It also does a little bit with your wrist. So that's why the wrist involvement is going on here. So Gab's going to start with her elbow bent, in a bent position, and her palms facing the ground. And then she's going to slowly lower her arms, nice and controlled, into that end range position where her palms are then facing up. Great. Yep, there she goes. So start with your palm facing up at the top, and then slow, 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 slow is the key on the way down as you open up and bring your palms to the sky. She can add weight to that, obviously. Once you get to the point where it's not painful to add weight, that's how you strengthen that bicep muscle to help avoid straining it again in the future and to get it nice and strong. So thanks for demoing, Gabby.
Thank you. I wanted a bicep workout today. All right. So lastly, we're going to look at the calf or the gastrocnemius, which is another commonly strained muscle. So Sarah, back to you for the demo. Also, just to note, everyone, make sure you have us on gallery view so that way you can see both of us at one time when we're demoing these exercises. Okay, so for the calf, you would start for this one in sitting, and then you're going to go ahead and go up on your toes, lifting your heel off the ground, squeezing that calf muscle, hold for 10 seconds at the top, and then lower down. Great. So this again, this is a little bit of concentric in here, but it's not against gravity or body weight. So the isometric is really that squeeze at the top. And this again is for that early phase, should be relatively pain-free. If we wanted to move to the late phase, we're going to use that handy step that Sarah has in that room. And she's going to go ahead and go on the top of it. If you have a step at home, if you don't have a step at home, you can stack 2 textbooks if you have them, something like that, so that you're not too high off the ground, but a good amount. She's going to rise up onto her toes with both feet. She's going to lift one foot off the ground and then slowly lower down on one, really controlling. So gravity is going to try to make you plop down. It's important to really kind of control that and use the muscle the whole way down so that gravity just doesn't make you fall. And then you could do each foot alternating, or you can do all reps on one side and then switch to the other side. Thanks, Sarah.
Get tight.
You got the harder ones this time.
I know, I did. I really did.
All right, so I think we're going to bring George back now to start giving us some questions for the Q&A. So if you've been sending questions the whole time, great. If not, please start putting them in now.
All right, guys, we have a lot of good questions. I thought you guys did a great job with the exercises. One of the main questions we're getting is, what is the difference between a strain and a sprain?
I could take that one. So Gabby talked at the beginning about the difference between a tendon and a ligament. So a tendon connects the muscle to the bone. So a muscle or a tendon can be strained. Those muscle fibers get torn. A sprain is when you have a tear of a ligament. So like in your ankle, you have a lot of ligaments, but especially ones in particular that tend to get sprained, connect one bone, like the top of your leg bone to the top of your foot bone. And when that ligament tears, that's what's called a sprain. So ligament sprains, muscles and tendons strain.
Great. So we also got a question about an ankle sprain, just very quickly. Were some of the exercises that you showed for the legs, would that also help with the ankle sprains?
I could take this on. Yes, so sprains are, like Sarah said, they're a little bit different. And if you're unsure, you should definitely come in and get it looked at, because there are different grades of sprains and you would treat them a little bit differently in the beginning. But in general, as long as they're pain-free, doing things like the RDL for stability, the calf raises to get the muscles around the joint nice and strong are good. So in general, I'm going to say yes, but again, it depends on what grade it is and how far out of it you are. So as long as things are pain-free, that's good. But when in doubt, you should always come in and kind of get it looked at to make sure it's an exercise appropriate for you. Great.
Okay. So we're getting also questions on laxity and what the term means. If you see that on like a MRI, can you elaborate on that word?
I think those were on my slide. Do you want me to
take it, Gab?
You can add if I don't do a good enough job. So I think the slide that that had that on was when I was talking about the grades of muscle strains. So the grade 1, there's no laxity detected, and grade 3, there was severe laxity. That just means the range of motion that your joint, so like if we use, let's say your knee as an example. So your knee should be able to get to straight. If it can go farther, or depending on the grade of how much farther it can go, your joint is lax. It basically means flexible, but in that case, it'd be too flexible. Sarah, do you want to add to that?
Yeah, no, I think that's good. Basically, if it can move too much, in this case, because maybe the muscle was torn to a degree that it's maybe completely ruptured, then you're gonna get laxity at the ankle. So for example, like with the calf or the Achilles, if you rupture your Achilles, your ankle is gonna, it's gonna be very lax and you won't be able to have control over it. So without strength, your joints can be a little bit more lax. So that's part of what we work on in PT, is like developing that strength to have control through the full range of motion in your muscles.
Awesome. Okay. And how does like tissue healing affect somebody as they continue to age?
I can talk about this one first if you want.
Go for it.
So as you get older, there definitely is a difference in tissue healing. It should still occur, but it might occur a little bit slower. So those timelines, you noticed how they were kind of larger. So the first phase was like 0 to 5 days, then 3 to 28 days, and then 3 days to 1 year. I think age definitely plays a part in how long each of those phases takes. So as you get older, you have a little bit less of an ability to rebound. Like, you know how kids are springy and just kind of come back from things. Like as you get through your 20s, your 30s, and then, 50s, 60s, it definitely starts to slow down, but it does still occur. Sarah, do you want to add anything to that?
No, that was great.
Okay, great.
Awesome. Thank you. And then when you are dealing with a muscle sprain, what's the best thing to do? Should you put ice, heat, any, also, what do you think about like the topical analgesics?
Yeah, so we talked about ice a little bit in that kind of like early phase slide. So ice is great for managing pain, especially if your muscle is really sore. Ice tends to make it less sore afterwards. So especially like if you're doing PT or you're in your rehab phase of exercises, sometimes ice can help because we work that muscle. We want it to get better. It might be a little bit sore afterwards. So ice is good afterwards. Heat will just kind of increase that inflammatory phase. So sometimes kind of after the initial phase, if you want to get the muscle warm before you work it, part of the reason that people strain muscles a lot is if they don't warm up properly. So heat can kind of help warm up your muscles a little bit. Like you might notice that if you take a hot shower, it feels a little bit better because the muscle's a bit warm. So it's good maybe beforehand, but ice is a little bit better afterwards. I would say that that's probably where to go in terms of heat and ice. George, is there another part to that question?
Yeah, someone was asking about the topical analgesics, like a BioFreeze or a Bengay. What is your opinion on those?
I think so. It's all about pain management at that point. So for some people, they work super well. For other people, they kind of don't notice a difference or they hate the smell. I don't know. I feel like it's very patient specific. What do you think, Gab?
Yeah, I think they're definitely not the end all be all. Like they're not going to speed up your healing, but if they make you feel better or good enough to do maybe your isometric exercise in the beginning, like something like that, they're good to just get you through, or if you have to go to work and things like that, but they're definitely not going to be what heals you quicker. So don't feel like you have to, only if you want to, type of thing.
Yeah, I think it's also important to maybe ask your doctor about those questions, and especially if you have allergies, be careful with some of those brands. Okay, another question we got here is pretty much what happens if you don't do anything with the muscle strain? Can it get better on its own?
So it can get better on its own, but so Sarah kind of alluded to this. There's a reason that the strain happened in the first place, right? So even if the strain itself heals without you doing much, probably not going to heal as strong because again, it's new fibers and things like that. So they haven't been, strengthened yet. And also, if you don't address the reason that you got the strain in the first place, so like Sarah said, maybe other muscles aren't working the way they should be, and now your hamstrings are trying to make up for that and they're getting overworked, the chances are that it'll happen again. So it's usually good to get it looked at, figure out the cause of it. That way you don't have to deal with this over and over again as you try to do the things that you like to do. You want to add anything there?
Totally, yeah. Especially with what we talked about, those proximal hamstrings, like hamstring strains, like up by your butt, like that especially is one that kind of lingers and it comes back, it comes back, and it comes back. And a lot of times maybe it's because your glutes aren't as strong because we sit on them all day. So especially that one in particular, we want to make sure that, you know, you're using all of your muscles the correct way and that you're not overusing the muscles that's just going to keep getting strained again and again. But it does heal. Muscle, like the muscle fibers do heal on their own, just maybe not as well. And we won't address the root cause.
Awesome. We're getting a lot of questions also on the like the shin splints as well as quad muscle. Maybe you guys could do a quick review on those two, and maybe some things with that.
Sure.
Totally.
Yeah. For quad muscles, at least, the same principles apply, right? So your quad, it extends your knee, and a little bit of it maybe also bends your hip. So it straightens your knee and it bends at your hip. So what we can do early on are kind of some isometric quad exercises. So for example, if you're sitting and you have something that you can press into, like maybe even the wall, you can just kind of like lightly kick the wall and you'll feel that quad working a little bit. If it's down here, that's a good way to start isometrically working your quad. And then we can work into some higher level exercises. But the quad is also a very commonly strained muscle, especially if you're maybe kicking a soccer ball where you're reaching back on your wind up to kick. That's when you're stretching it and using it at the same time. So that's a lot of times what happens with the quad strain. But same principles apply that we've talked about through this whole seminar.
And then for the shins, the shin is not usually a strain necessarily. Shin splints are a whole other beast to get into. That can be a whole hour-long talk on their own. And usually those come from, that's one of those ones that comes from other areas of weakness or poor body mechanics or things like that. So I would encourage you, if you have shin splints, especially if you're a runner, to come get evaluated, just because that could be its own hour long. So I can't even get totally into that one.
Okay.
Totally agree.
So there's also a question on, after you work out, you get some muscle pains a couple days after. Someone was wondering if you could elaborate on that. Is that a muscle strain that's going on there?
I can take this one. So a couple of days after working out, feeling some pain. So that's what we like to call in the PT world DOMS. So that's usually delayed onset muscle soreness. So that's largely normal as long as that pain is more like a soreness, not a sharp shooting pain, and goes away after about 24 hours. It is normal for it to come on 24 to 48 hours after working out. That's just the muscle that worked kind of repairing itself. So that's why it's also important to take rest days and to make sure you're not working the same muscle over and over again every day without breaks in between, because it needs that time to heal, like 24 to 48 hours. Again, if it's a sharp shooting pain, if it hurts to walk, if it hurts in any way that doesn't feel like generalized, just like I'm a little sore and I could tell it's because I worked out, I would encourage you to see a doctor. But if it's just for less than 24 hours, it feels sore and it's the muscles that you worked out a day or two ago, it's probably okay. What do you think, Sarah?
Yeah, definitely. It's actually a good sign because it means that you worked the muscles in a way that they are remodeling themselves. So the soreness, the delayed onset muscle soreness, is actually great because, you know, we're getting like these this increase in blood flow and almost like healing factors that are being sent to the area because you're kind of like breaking down the muscle and rebuilding it. It is like, that means you did the right thing pretty much.
Awesome. Okay.
That's that hurts so good type of pain.
Totally.
We got a question here asking about the shoulder, or actually any joint in general. Is it better to exercise before you do activity? I mean, stretch before you do activity or after activity to help with the muscle strains?
I can take this one. So for pretty much any part of the body, right? There's different ways you can stretch. So there's dynamic stretching, which is more of that kind of like motion, early motion that we talked about, where I don't know if you've ever played sports or anything or watched any of the athletes warm up, but nowadays they're kind of doing more what we call dynamic stretching. So maybe some leg swings, maybe some knee hugs, but you're not holding any position for longer than a couple seconds. So maybe you're doing something like, you know, you're doing a knee hug, hold for a second, come back down, hold for a second, come back down. A little quad pull, back down, quad pull, back down. But you're not necessarily holding a stretch for 30 seconds. It's a good way to help the muscles warm up, but you're not really like putting it to its end range. You just want to get that blood flowing and get the muscle warm. After you exercise, that's when you can static stretch, is what we call it. So like that's when you can, you know, stretch your hamstring, sit there for 30 seconds. It feels good, especially after you just worked out the muscle. That's when you can do that nice long static stretch. But if you do that right before you try to exercise, you're going to have just lengthened the muscle as long as you can and then try to get it to work. And that's what they don't like. That's when they have that tendency to strain. So warming up with like shorter movements is definitely better than static stretching and then going right into an activity. That if you do that, you're going to put yourself at risk for a muscle strain or other injury.
Awesome. Okay. And as far as exercising goes, is there anything in specific that you should really stay away from? Anything that maybe is going to, you know, impede your performance or possibly cause any issues in those muscles?
Like after a strain?
I'm
I
sorry?
mean, is it like after a strain or just in general life?
Yeah, maybe, after a strain in general.
So after a strain, the biggest thing to avoid, like Sarah said, is you don't want to stretch a strain. Like just ingrain that in your mind, like do not stretch a strain. That is how it happened in the first place. Other than that, so say you had a hamstring strain and you still really want to work your core or your upper body, that's fine. Motion is good for you in general, and that protected early motion, even of the hurt muscle or joint, is good, but that's what you need to be more careful with. Everywhere else, it's still fine to exercise. But again, like if you aren't familiar with what an eccentric versus a concentric contraction is, and you're not sure if a certain exercise is that, I would ask someone, I would look it up, I would come to a PT, because you don't want to accidentally be doing an eccentric exercise a week and a half after straining a muscle, right? So in general, the muscle that isn't hurt, every other body part is probably okay to do early on, but you really want to make sure you're doing that isometric in the beginning of the strained muscle and that protected early motion.
Awesome. All right. Is there anything specific for, let's say, back muscles or thoracic spine that you recommend, you know, when discussing like a strained back muscle, even the lower back, you guys could go into on what maybe they should do or not do?
Yeah, so the back is a tough one. One of the things that you want to get checked out by either a doctor or PT, you want to make sure that you didn't injure your back kind of like somewhere on the inside, like rather than just the muscles, you want to make sure that you didn't do something a little bit more severe. So for the back, it's always good to get it checked out just to be sure before you put yourself in harm's way by doing any sort of exercises. If it is in fact just a strain, there are the principles are still the same, right? So early motion, so maybe something like a cat-cow, or like we can show you a bow and arrow or an open book stretch. To move is good. So to move your spine, to go for a walk, those are good things. To just sit in a back stretch position for a long period of time at your desk is not a great thing. So early motion, I feel like, is the best thing for the back. And then working on developing your core. That's kind of the key later on, because a lot of time our back muscles tend to overwork, especially if you bend forward and you twist or something like that. Your back seizes up because it's doing too much when your core should be stabilizing your spine. So if you come to PT, we'll work on some core exercises once we've gotten you out of that painful phase. Anything to add, Gab?
You hit the nail on the head. I think it's just, again, a lot of reasons that the back gets strained is that core weakness, and that's kind of what you would want to get started with, but again, it has to be safely. And motion is the best thing. It's not laying on the couch. I know everyone says they get laid up with those. It's really important to try to make yourself walk or do some gentle stretching. Well, not stretching, but gentle motion.
Yeah, gentle motion.
All right, great. So getting a couple questions on the IT band and how that plays into muscle strains, possibly knee swelling. Is there anything you guys can elaborate on that?
I can take that one.
Okay.
So the IT band is fun. It's not actually a muscle, right? So what Gab pointed out, like all of those little muscle fibers that get torn, the IT band is just a band of what we call connective tissue. So it doesn't have any of those muscle fibers. It can't shorten, it can't lengthen. Versus like your quad or your hamstring, other muscles shorten and lengthen. The IT band does whatever the muscles that attach to your IT band make it do. So if your quad muscles are tight, or your hamstring muscles are tight, or some of the muscles up at your hip and your glutes, those are all muscles that have attachments to your IT band. So we want to work kind of on those muscles and making sure that they're the right length and that they're strong enough. And that can often help with the knee pain. So a lot of times if you have what we call like IT band syndrome, or that pain on the outside of your knee, especially with runners, it might feel just like really good to rub it and really good to rub that area. But what you need to do long-term is actually strengthen typically the muscles up at your hip to make sure that your, outer quad and hamstring and some other hip muscles aren't overworking and yanking on that IT band, causing that pain where it attaches down at your knee. So that's a fun one to deal with.
Great. Okay, so we still have a couple more minutes to answer some more questions. So please type some more questions in there. We'll go on to the next one though. So if you're dealing with, let's say a shoulder injury, when is it like the best time to start exercising after, an injury? I know sometimes it depends, but maybe you guys could elaborate a little bit more on that.
So yeah, the biggest phrase in PT is it depends, because it really does depend on everyone's individual injury. But let's say there is a strain of, I don't know, your rotator cuff muscle or one of your neck muscles that attaches to your shoulder. Again, starting with that early motion, that you can start almost right away. You can do some gentle, shoulder rolls. You can do some gentle neck rolls. You can do some arm circles. That's okay. And as Sarah pointed out in her slide, all active exercises should be pain-free. So if you're having pain with even just a little shoulder circle, something more serious may be going on, because there's a lot that goes on, especially in the shoulder and neck area, similar to your spine, right? There's a lot of other things that aren't just muscles. So maybe you think you strained a muscle, but you actually have something with your labrum in the shoulder, or, a different ligament or something like that. So if you have pain with even gentle motion, you should definitely go see a doctor, a physical therapist, someone to get it checked out. But in general, you can start, day one after an injury of trying to do something isometric, an isometric contraction or some gentle motion, because the longer that you leave it stiff, like Sarah gave the example of being in a sling, that's going to shorten everything up and not let you have your full motion and full function for a while afterwards.
All right. Okay, great. We just got a couple questions coming in, and they're asking the same thing about foam rollers. Maybe you can elaborate on the foam rollers. Is it good to use before exercise? Is it going to help? And is it as effective as stretching?
You want to start, Sarah? This is controversial.
This is a great question. I feel like it's a hotly debated topic. Foam rollers are great for warming up, like especially if you don't have, like if you are someone who wants to wake up and go for a run in the morning when you're kind of like still stiff and in sleep mode. Foam rollers can definitely help warm up those muscles. They'll get some increase in blood flow. They'll stimulate kind of the tissues and help with warming up. So it's definitely a good thing to do before exercising, especially if you're feeling stiff, you haven't moved in a while, you've been sitting for a long time. They're definitely good to use for that, for warming up specific muscles. You can also use it for afterwards. A lot of times people like the feeling of like rolling out their muscles when they're tight. It's a great way to help, again, stimulate that blood flow, which makes the healing process happen a little bit quicker. In terms of foam rolling versus stretching, kind of whatever feels best. This is probably a lot of you guys don't want to hear this, but both of them don't make a ton of difference. What really matters is how much strength you have through your full range of motion. So a lot of times you just feel that tightness, and what it really is a lack of strength through your full range. So foam rolling it and stretching it is going to feel great. It's not going to solve your problem long term. It's going to feel good for a couple minutes. But it definitely feels nice, and it's not a bad thing to do. It just means that there's probably something going on that you want to address in the muscle. If it's continuously tight and it keeps irritating you, it's more probably the lack of strength than anything else.
Like Sarah and I are very similar in our treatment philosophies. So you'll have some people who live and die by the foam roller, and Sarah and I are probably more of the people that say, well, you just need to get stronger. But like Sarah said, it can bring blood flow to the area. If you are going to use it before an exercise to warm up, make sure you follow it with one of those dynamic type warm-ups. Like, I'm a big proponent of muscle activation more than a dynamic stretch even, or a foam rolling before. But if you're going to do one, always, always, always do some sort of muscle activation before you exercise, especially something like with impact, like running or jumping. So make sure it's always just followed up by something like that.
Totally.
Awesome. Thank you. We have a question here about during the middle of the night. I don't know if they're referring to the cramping, but there's pain in the lower shin, calf area, and it goes away after about 10 minutes. What do you think about that? I'm sure you guys get that question a lot in the middle of the night. They start dealing with that pain.
Yeah, we've gotten that before. Some people call it like a Charlie horse, or basically like sort of a cramping sensation. It happens commonly in the calf. And so that can be from a variety of factors, right? Depending on a lot of different things. Sometimes it can be, maybe you're dehydrated, maybe your muscles are really tight from workout and stretch afterwards. Whatever it is, it can be from like so many different things that it's kind of hard to tell. Sometimes it's musculoskeletal, sometimes it's, nutrition and hydration. So it's a good thing to get checked out if it's happening continuously.
Mm-hmm.
Say.
Yeah, there are definitely reasons more than just muscular tightness why something like that could happen. So if it does happen persistently, you do want to see your primary care doctor or a physical therapist or something like that. But also eat a banana and drink some water and see if that's
Okay. We're going to wrap up with two more questions that we have here. One of them is regarding wearing a compression sleeve. Let's say around your knee for jogging. Will that help? Will that prevent injury? What do you think?
I can start with this because I have a younger brother who loves to wear sleeves because they look cool when he plays basketball. So a compression sleeve, it's not going to prevent an injury. It's probably not going to hurt you either, but it's definitely not going to prevent anything. I think it's fine to wear if you really want to, but there's not like much of a benefit where I would say go like spend your money on that necessarily. Sarah, do you agree? Do you have a different opinion?
Yeah, I think so. So I think the feeling that a lot of people get from the compression sleeve is like the support and this kind of stabilization that it gives you the sense of. So what that means is, maybe you should be getting that stability from your muscles. So if you feel like you need the compression sleeve to run or do some sort of workout, then it means you might be lacking some muscular stability. So it's not a bad thing to wear it if it makes you feel better, but I would say take note of the fact that maybe it's something that you could work on, say in PT, right? If you get a PT to kind of give you a full exam and figure out where your limitations are, that could kind of help solve that. It shouldn't be a crutch.
Right.
Awesome. Okay, so we're going to wrap up with this question here. And if we didn't get to you or you have other questions that come after this, we'll try to reach back out to you personally and get that answer to you. So the last one here we got is for tight calves and an Achilles, or for any tight muscle for that matter, should we even be concerned about strengthening, or should we just continue to stretch and that'll be, you know, all we need?
I think Sarah and I are going to say
Sarah wants to answer this one.
Yeah.
You want to start, Sarah? You can start. Sarah's itching.
I'm itching. So kind of like I said before, like a muscle's gonna feel tight if it's weak through a certain part of its range. So like if you keep using it and it's not strong enough to do what you're asking it to do, it's gonna feel tight and crampy. You can stretch it all you want. It's probably gonna still feel tight the next day. So, you know, you can go for an eval and figure out what's tight, what's loose. Like we'll figure out the muscle imbalances that are there, but just stretching that muscle really won't do much for you in the long term. I think Gab probably knows, but.
Definitely agree. And even if you can make a tissue length change by stretching it, which 90 seconds minimum, 3 times a day, it's not gonna maintain that new length unless you address why it's getting short in the first place, right? So the reason it's getting short is probably because it's overworking, because there's 2 ways a muscle gets short, right? Contracting makes it short, so working, and then tightness or spasms, right, make it short. So sometimes if it's being asked to contract way too much over and over again, it just stays in that shortened position. But why is it being asked to do that? And it's usually because of weakness somewhere else and it's overworking. So stretching, again, it's not bad, but it's not going to make a lasting change if you're not addressing what's causing it to be short and tight in the first place. And that's our soapbox.
All right, great guys.
Step off now.
Thank you so much. I'm pulling an audible because this question is extremely relevant. It will be the last one. It's about stand-up desks. Now that people are working from home most of the time, does that increase your risk of strains, and what are some things that we should think about with this?
I love standing desks. I think so. Any sustained position is not good for most of your body, right? So sitting all day, everyone says, oh, sitting is the new smoking. But if you also stood all day, it would similarly overstress all of your joints. So a standing desk is great because it gives you the option to do both. So you should really mix it up throughout the day and not be in any single sustained position for more than 15, 20, 30 minutes. And even taking a break from sitting and standing and taking a walk when you can, especially if you're home and you're not on a live Zoom meeting, maybe take a walk, pace back and forth while you're talking to your coworkers or doing what you have to do if you can. What do you think, Sarah?
Totally. I tell patients about the 28-2 rule. So if you sit for 20 minutes, stand for 8 minutes, move for 2 minutes. That's typically a good like breakdown. You shouldn't be standing for 2 hours. You're going to be getting tight like you would sitting. Your muscles are working in kind of different ways, but they're still going to get kind of tight and irritable. So if you go from standing all day to trying to do an exercise right away without warming up, it's kind of the same risk as sitting all day would be.
I love that rule. I'm going to take that.
28-2.
28-2.
Dr. Lloyd.
All right, guys. Thank you for answering all those questions. We're going to wrap up by just going over our presenters again and showing you their contact information and ways that you can contact them. So first up, we got Sarah here. And second up, we have Gabby. Thank you both again for an awesome webinar. We're going to leave this slide up for a little bit. Feel free to jot down that information and ask as many questions as you have to them. All right, and then last up you have my email as well as Michelle's email. Thank you, Michelle, for all the back end help that you helped with us today. Great. All right, thank you all for your time today. And just to review, we have 20 clinics in the New York City metro area. We're following all the CDC requirements and trying to go above and beyond those CDC requirements. Sanitizing stations, mask wearing, temperature checks are all involved with every visit. And if you're looking to set up an appointment, you can feel free to also go to the link there at spearcenter.com/appointment. Thank you all. Bye.